Assalamualaikum warahmatullahi wabarakatuh and hello everyone. My name is Tengku Adham bin Tengku Harizul Azwan. I'm MU1 medical student from Faculty of Medicine and Health Science from UMS. Today, I would like to present about integumentary system. In this presentation, I will cover about the skin anatomy, skin physiology, skin biochemistry, skin injury, and then the treatment for that injury, and then the last one is well-known specialist. Okay, I will start with the skin structure or the skin anatomy. As you can see the big diagram here, it is the detailed anatomy of the skin. So, the skin is composed of epithelium, connective tissue, muscle, nerve, blood vessel, and associated structure like glands, hair follicle, and nails. It can divide into two basic layers. The first one is superficial epidermis. It consists of non-vascular keratinized stratified squamous epithelium, and also for the second layer, tough collagen-rich dermis plus fatty hypodermis. Okay, for your information, hypodermis is also known as subcutaneous layer, consists of connective tissue and adipose tissue. So, I made a table for you guys for further understanding. So, I'll differentiate epidermis, dermis, and hypodermis. As you can see, your palm and your hand is different skin. If you notice at your palm, it's more thicker than your hand, which is more thinner. This is because the human skin is divided into two, which is thick skin and thin skin. Thick skin has thicker epidermis layer, numerous sweat gland, lack of hair follicle, sebaceous gland, smooth muscle fiber. The example of thick skin is the fingertips, palms, and sole. And then for the thin skins, the epidermis is thinner, contain hair follicle, sebaceous gland, sweat gland, smooth muscle fiber such as erector pili, and it distributes all over the body. Okay, and then I will proceed about the second part, which is the skin function or skin physiology. Skin function in the thermoregulation. Thermoregulation is the adaptive of the skin during the change of temperature. For example, there is two conditions, which is hot condition and cold condition. I will explain about the hot condition first. As you can see the picture and the table, the hot condition, blood vessel near the skin surface dilated or vasodilation, allowing increased blood pressure to the skin. Sweat gland will produce sweat, which it will evaporate and give the cooling effect of the skin. And then hair erection or pillow erection give the minimal effect by lies flat against the skin, providing minimal insulation. For subcutaneous fat, it also has minimal role. Fat acts as insulation but does not contribute significantly for cooling. And then we will move to cold condition. The blood vessel will constrict, vasoconstriction, to minimize heat loss from the skin, preserve warmth for vital organ. Sweat production will decrease to prevent further cooling. And then the hair follicle will contract, or the term is pillow erection, will trapping the air to create an insulating layer, aiding in heat retention. And then the subcutaneous fat during cold condition is served as insulation. It will reduce the heat loss and preserving body warmth. So we will move to the next function of skin, which is skin as a protection. The cell junction prevent the bacterial invasion because the skin has tight junction, and then the fat in skin also will reduce the evaporation of water, guarding against dehydration. And then the oil sebum on the skin surface will keep the skin and hair oily and has bactericidal effect. The production of melanin by melanocyte protect from UV light. Skin is the largest organ of the body, weight 4.5 to 5 kg, which means 7% of the total body weight. So, we will move to the third part, which is the skin metabolism or biochemistry process occur in the skin. I'll choose the topic of vitamin D synthesis. Sunlight activates precursor molecule in the skin to produce calcitriol, the active form of vitamin D. Vitamin D for absorption of calcium in the gastrointestinal tract or GI tract. So start with the ultraviolet B UVB radiation from sunlight penetrate into the skin. UV ray convert a precursor molecule named as 7-dehydrocholesterol found in the skin into pre-vitamin D3. So that pre-vitamin D3 undergoes a thermal process converting it into vitamin D3, or other name is cholecalciferol. Vitamin D3 is transported via the bloodstream to the liver. In the liver, vitamin D3 undergoes hydroxylation, turning into calcidiol or 25-hydroxy-vitamin D3. Calcidiol travels to the kidney where it undergoes another hydroxylation, becoming calcitriol or 1,25-dehydrovitamin D3, the biologically active form of vitamin D3. Calcitriol aids the absorption of calcium and phosphorus in the intestine, crucial for bone health, and it also helps to regulate calcium level in the blood, supporting bone mineralization and overall body function. So for the fourth part, which is the skin injury. A skin burn is an injury to the skin or underlying tissue caused by exposure to heat, chemicals, electricity, radiation, or friction. So the burns of the skin can be divided into 4 types, which is first degree burn, second degree burn, third degree burn, and fourth degree burn. I will explain detailedly about the degree of the burn. So for the first one, first degree burn. Superficial burn affecting the dermis, outer skin layer. The symptoms such as redness, mild pain, and swelling. The tissue affected here are epidermis, and it caused by sunburn. And then for the second degree burn, it affects the epidermis and the part of dermis, which means deeper layer of the skin. The symptoms such as redness, blistering, severe pain, and swelling. The tissue affected here are epidermis and the subdermis. The example will caused by scalds or severe sunburn. And then for the third degree burn, it destroyed the epidermis and dermis and can extend into deeper tissue. The symptoms such as you can see white, blackened or charred skin, numbness due to nerve damage. The tissue affected is the epidermis, dermis, and deeper tissue. It can be caused by contact with flame, chemical, or prolonged exposure to heat. And then for the last one, fourth degree burn. It will destroy all layers of the skin and underlying tissue, reaching muscle and bones. The symptoms such as scarring, severe tissue damage, or potential nerve damage. The tissue affected is epidermis, dermis, deeper tissue, muscle, and bone. It may caused by severe electrical or prolonged flame burn. Moving forward, I will talk about the skin treatment procedure towards the burn injury. Skin graft is a surgical procedure used to replace or repair damaged skin with healthy skin taken from another area of the body known as autograft or from a donor known as allograft or xenograft. Skin graft play a critical role in the burn treatment. So here, I will explain the reason why using the skin graft in the burn treatment. For the first one, skin graft can give protection. Skin graft cover the burn area, acting as a barrier against infection and preventing further damage or fluid loss. Also, skin graft can give the healing promotion by replace the damaged or lost skin with healthy skin from a donor side. Graft facilitate the healing process. And then, skin graft also can restore the skin function. Grafted skin help to restore the body protective barrier function, reducing the risk of complication and promoting faster recovery. Also, skin graft can give the cosmetic improvement. They can improve the appearance of the healed area, reducing scarring and deformities for better aesthetic outcomes. So we arrive at the last part, which is well-known plastic surgeons. In Malaysia, we have Dr. Shah Jumaat Muhammad Yusof. He is the president of Malaysian Society of Plastic and Reconstructive Surgery. He also worked at Prince Court Medical Centre, Kuala Lumpur, and he also a senior lecturer at Faculty of Medicine in UiTM. His special interest in the lasers, aesthetic surgery and burns. And then, from the worldwide side, we have Dr. Bulan Cihan Timur from Turkey. He is the top plastic surgeon in the world. He had performed more than 60 types of aesthetic and reconstructive procedure. The work's experience exceeds 20 years. He specializing in face, breast, body, fat transplantation and stem cell. So, we arrive at the end of this presentation. I would like to thank all of you for your focus during my presentation, and thank you so much. Have a good day. Bye bye.